What do we mean by value in healthcare? What does value actually mean to patients? It is about the end-to-end experience, about the patient journey. It is about what happens before and after. It starts at home, on the way to the hospital and to the doctor's appointment. What happens during that conversation with the nurse? What happens during treatment and during surgery? Do I actually derive a benefit from that new pill that I'm taking every morning? Or do I feel better? Or do the patient stop actually their treatment because it makes them feel dizzy and then they don't derive benefit? What happens after that knee replacement? Can the patient actually walk again 3, 6, 9 months later and resume their daily activity? Today, only the knee surgery is being paid for, is being rewarded, and there is no incentive built in the system to reward actually for the results and whether the patient is pain-free and can go back to work. This is the topic of today's second podcast in a series of 6 about the quandary of healthcare, and I'll talk a little bit about the what and the value. Other industries have long recognized the power of the customer and how important the consumer experience actually is. But healthcare is catching up, and that is what value-based healthcare is all about. It is about the patient experience and the results that matter to patients. Simply said, value-based healthcare is about 3 principles. It is all about the health outcomes and the results that matter to patients. Secondly, it is about defining a population of patients that all share the same needs. And thirdly, these outcomes need to be measured in that patient population in a clearly defined time frame. There are 2 great real-life examples that I'd like to share with you today that really showcase what that means in reality. The first is Oak Street Health, which is an organization for elderly, underserved communities under Medicare, and they have completely shifted their model from rewarding services and products to paying for how healthy their population is. Very specifically, they do not only include also social determinants that can interfere with health, such as transportation, for example, but they also invest heavily in the education of their patients to empower them to fully understand their diagnostic, their disease, and their treatment. They define 4 clearly distinct patient populations based on their different levels of sickness, and this assignment is actually done together with the patients, the caregivers, and social workers and others in the multi-stakeholder team. As an example, let's say blood pressure levels. They will determine after a certain period of time that's predefined whether those blood pressure levels were within that predefined range and evidence-based range or not, and the rewards are structured accordingly. Overall, this new concept has led to 41% reduction in hospitalization rate, which means that patients are kept home longer, and that is reflected in the cost structure. The second example is the Diabetes Consortium in the Netherlands, which regroups in a multi-stakeholder team families and kids with type 1 diabetes, and they will define together which outcomes will be measured and when they will be measured, together with other important caregivers like psychologists, like nephrologists, like ophthalmologists, etc., together with the diabetes specialist and the patient and the family. Recently, Diabeta has signed a 10-year contract with a Dutch insurer, and rewards will be structured according to a malus and bonus system, depending if outcomes were met or not. In summary, for me, these 2 examples really showcase how value is not only derived for patients, but how that also generates value for other stakeholders in the systems, like providers and payers in these cases. So you may say, this is all good, why is this not happening more broadly? And indeed, in order to scale this, we need to share best practices on what works and what doesn't, because both scholars and practitioners have long agreed that value-based healthcare is the way to go for the future. So to conclude for today, I'd like to share 2 books. The one is from Marty Mockery, The Price We Pay, where he nicely showcases how important the doctor-patient relationship is and how patients derive value from an outcomes-based system. Secondly, hot off the press this year, published by Professors Bertini and Königsberg, The Ends Game, And although this is not specifically only on healthcare, it nicely showcases how industries and business derive value when they shift from selling products and services to outcomes and delivering value. So with this, I'd like to conclude and see you back next week when I'll talk a little bit about who the stakeholders are that need to work together and forge new, novel partnerships to restore the balance between innovation and affordability in healthcare.